Welcome to the PD Avengers chat. We're here every week chatting about Parkinson's disease and all things PD. This week, we want to tell you about a couple of things. First off, if you want to contact us, you can. Speakpipe.com/PD Avengers. It's real easy. Or if you want to participate in the Spark the Night experience, just go to sparkthenight.org and find out all the information, and you can do that too. It's coming up April 11th. Tim and Sonia and I are here to talk about YOPD, which is young onset Parkinson's disease. And Tim,
Yes, sir.
what was your feeling when you were diagnosed with YOPD? What did you know it to be as far as the differences between that and a traditional Parkinson's diagnosis?
Well, I don't think I really even thought about a different diagnosis. I had known my father had Parkinson's, so I knew his experience, and so that's what I drew on, and that was terrifying. So I just decided I was going to ignore it. Like, this is crap. I don't want to have anything to do with this. So I was shaking a little bit, so I just decided I was going to ignore it and go on. That's what I tried to do for a long time.
Sonia?
Yeah, I mean, I was pretty much the same. I knew that intellectually, I knew that I had YOPD, but emotionally, I didn't want to accept it for a long time. And still from even my medical training, I could harken back to maybe one obscure part of one lecture that mentioned that it could happen in younger people. Otherwise, it really wasn't, even in my mind, a disease of older white men, which until now has always been something that's shown up in the medical textbooks, really. And me being young at the time, 28, and ethnic and female, it was shocking to me.
Well, and for me, I didn't know anything about Parkinson's. Am I gonna die? What's the deal here? You know? And so and then I didn't even know that there was a difference between YOPD and PD. And since that time, it's been, you know, it's been 8 years. Wow, 8 years. And over the course of that time, I've discovered that they're different diseases.
Mhm.
They and there's different pressures put on YOPD. We still have families, we still have jobs, we still have so you're living life with it, and it's not something that's happening in the twilight of your life. It's happening in the heart of it.
Mm.
That's
Yeah, we know there's certainly differences. We know that women, people living with YOPD, they tend to progress slower, tend to not have as many cognitive issues, but can get more dyskinesias, for instance, or more side effects from the medications. And as you mentioned, there's just a whole host of psychosocial stressors that are different for people living with YOPD. We're at the prime of our earning potential. We're at the prime of our building families. For women in particular, we're dealing with hormonal changes on a monthly basis. We're dealing with pregnancy and childbirth. So there's a whole host of psychosocial stressors that are different from those of us who have this disease early on in life compared to our later counterparts.
And we have to acknowledge that most people don't have a clue that exists. That
Mhm.
they hear Parkinson's disease, they think older, later onset, and they don't have a single thought that goes through their head about what young onset looks like.
Mhm.
when people hear that I have Parkinson's disease, they're like, "You?"
Yeah.
And I'm, a fairly older white guy. So I can imagine that it's a shock to the system for people who um, are not the traditional thought of patient for Parkinson's. Do you think that YOPD is the first step in sort of branch in categorizing the different types of Parkinson's?
I mean, I think in general, I think we're going to find out that Parkinson's disease is a spectrum of of disorders or diseases. And I think that young onset Parkinson's disease is going to look different than late onset Parkinson's disease when we kind of figure this out from a pathology perspective, physiological perspective. So I mean, there's such heterogeneity when it comes to Parkinson's disease in general. No two people have the same experience with this disease. So there's definitely going to be something that comes up in the future about that.
And I have got nothing but anecdotal references to make here, but I mean, working at UTM Parkinson's and seeing all the people that I see with Parkinson's every day, there is a vast difference one from the next. It's shocking most days how different we are. Um, and yet we have the same disease. It's not possible. I completely agree with you, Sonia, that we'll find that it's a spectrum and that they're different because a 69-year-old diagnosed with Parkinson's, a 75-year-old diagnosed with Parkinson's is vastly different than I was at 46.
Right. No, totally. And do you, looking back now, appreciate your Parkinson's as a YOPD versus the late onset, or like how do you
I think it depends because it's even among the late onset, there are different categories within that, right? There you see different people respond completely differently to their disease. Then YOPD, you see there's lots of people with YOPD that I wouldn't want their Parkinson's for anything because they progressed way faster than I have.
right?
They're doing much more poorly than I have. And that's not again to mention the vast differences with women that Sonia mentioned.
And it all depends on where you're at and what kind of treatment you can get and
Yeah.
how aggressive your neurologists are, your MDS, and
Yeah.
I mean it all plays a factor. So it's interesting. All right. We'll wrap it up there. We had a good just chat about the YOPD. If you have a question, go to speakpipe.com/PD Avengers. Leave us a question there. Maybe we'll answer it next week. Tim, Sonia, it's great to see you as always.
Take care.